Good afternoon, everyone. Good day, everyone. Let us introduce ourselves. My name is Atia Faika as the first speaker.
Let me introduce myself. My name is Ayufira Margita as a second speaker.
And let me introduce myself. My name is Niken Harini Putri as a third speaker.
And we are here to represent Team 8 of Senior High School State 1 Kota Gajah English Club. Thank you. Ladies and gentlemen, both teams have agreed that COVID-19 can spread easily through the air droplets and it is not easy to solve. Today we will prove to you why the lockdown system are more effective at the end. In this debate today, we will not be talking about any economic problem from the COVID-19 itself, but instead we'll put our full focus towards the health problem, except if the opposition team were able to link back the direct impact of the COVID-19 towards the citizens' health, and we will also say that the economy will still also impact on our team. First, let's characterize the lockdown. Lockdown itself is a situation where the people is being isolated or restricted by the government from other people as a security measure towards the spread of COVID-19. In this debate, I will bring one argument, which is how effective can the lockdown system be towards the Indonesian citizen. Panel, looking at the situation, also the characterization of Indonesian citizen, we can see that many of them, especially the indigenous people, are unaware of how hazardous the COVID-19 spread is. Being the fourth world most populated country and it's also part of a developing country, there are still many unprivileged, also uneducated people all around Indonesia. Comparing the mass regulation, taking Jakarta as an example, with approximately 11 million people in the city, looking back to the characterization of Indonesian people, we believe that wearing a mask will not be effective enough to stop the spread because it has a limited ability to protect people only around 16 to 20% only. Another main factor of the inconsistent mask usage, for example, while eating, we will have to take off our mask in the public with many people surrounding, especially in places with poor air ventilation or places that uses full air conditioner, like the mall. The spreading of the virus would increase promptly as the virus would have a longer lifeline if it's in a poor air ventilation area. More to that, our team also believe that the lockdown is more effective than the PPKM system. The system that restricts the business time only, which is believed to be effective and also useful not only for the customer but also the businesses. Ladies and gentlemen, realize that also with the citizens' characteristic, it will only create more physical contact between each other because even with strangers, Indonesian people would talk to them, resulting on the ineffective mask usage. Just because of the lenience given by the government, people would forget about maintaining their masks and their gaps. Even though the police have started to discipline the citizen, the sanction for it is not strong enough to be able to scare the citizens and making them not repeat the same mistake. Panels also notice on the health side, there are many people who are still crazy about hunting masks, also hand sanitizer due to the outbreak. Moreover, there are still many infected patient guardians who are still in search for the oxygen because many hospitals who are overfilled with patients, resulting in not enough medical equipment such as the oxygen. Also, many patients being left untreated by the hospital, and this have indicated us the urgent need for the lockdown by the government in Indonesia, and that's why we propose this motion.
Today, I bring two trade-off to retro opposition team. First, we can give punishment to people who don't want the lockdown because this will have a different effect for society. For example, giving prison sentence or lighter ones such as sit-up, sweeping broad fine community, the punishment was given aiming for the common good. Second, the importance of public awareness of the dangers COVID-19 is very important to know the dangers of COVID-19. The lockdown is very important for public health, especially most people sometimes rarely comply with health protocols. Let me tell argument I bring two arguments. First, with the lockdown, can reduce the spread of a more massive outbreak, lockdown or in other words access closure or regulation that people must stay where they are accessed for some things are permitted and absolutely necessary. For example, looking for basic needs, searching for medical equipment. So if they are not locked, they will carry out all activities freely. With carrying out free activities, they can make direct contact with many people. For example, shopping at the market, work, and other activities that involve direct communication with other people. This situation can make the spread of the outbreak easier because the transmission of the COVID-19 virus outbreak can occur when someone touching items that might have been contaminated by other people's droplets. Then the virus will spread to the nose, mouth, or eyes for touching the contaminated contaminated item. According to the Lancet researchers, the coronavirus can survive for 7 days on contaminated surface and 4 days on contaminated big node. It will be inversely proportional if we implement a lockdown, even though we stay out the house but are still limited and not as free without a lockdown. Direct contact with the community will also not be as busy without a lockdown. Second, lockdown must be done so that the government is not late dealing with the corona, especially if we lock, but the government has tried various ways such as implementing health protocol regulation. Serious coordination relates service the preventing the spread of the coronavirus and imposing restriction on community activity, but the positive number is still high. Leader and the government must take first step by prioritizing public safety. We see that all around us, Indonesia risk station is not only not area that has been infected with the coronavirus, but all area have been infected with the virus. Some health facilities in cities such as West Java province are already falling overhead by the number of patients who have experienced a drastic increase, especially in some areas where the referral hospital in only have the little isolation. We can imagine what if there was an accumulation of patients infected with the COVID virus. The government and leaders must be firm, prioritizing public safety and health over economic stability. The government should also not be afraid of the costs that need be incurred this two-week lockdown. According to Law Studies Economic, Bima Yudhistira, if the costs are calculated with a lockdown, it will be much, for example, more expensive because the expenses will be more if the coronavirus continue to infect the community. For example, patients infected with the coronavirus reach a large number, so the facilities hospital will also with lost contact money complete it. Not only if we don't lock, the risk of losing gross domestic income will degrade, because if the virus continues to explode, then automatically gross domestic income will decrease. The impact on the economy is expected to be large and can cause the economy. A country in that line, millions of people will fall into poverty because more and more the number of unemployed and result of the cessation of some of production activity and the lack of demand that stimulate production activity. The health crisis should first be resolved and condition economic recovery. If health crisis is not handled properly, the COVID-19 recovery costs will be even more expensive. So why don't we just lockdown? It does not need to be like what applied in Italy to deploy armed forces. The lockdown policy is quick isolation the community to carry out activity outside the home for several weeks. If the lockdown is successful, the economy can also increase. I think this is enough. Thank you.
We do believe that implementing lockdown regulation more effective to stop the pandemic in Indonesia quickly. Let me explain some of the reasons that you should support our side. I will give you 2 points here. First, let's talk about the government who are required to pay more for the citizen and the government itself than the pandemic than in the normal situation. But the government have a solution to minimize excessive spending during the pandemic by implementing the lockdown regulation. Because of what if lockdown is not enforced during the pandemic, the government will definitely incur pay more than compared to implementing lockdown regulation, ladies and gentlemen. Let's compare government spending during lockdown and not. For example, lockdown in Jakarta every day requires 550 billion rupiah. So the 2 days until week lockdown will cost around 7.7 trillion rupiah. Assuming 70% of the national money circulation in Jakarta and the rest is in other areas. The total funds need to meet the basic needs of the people of Indonesia during the 2 days until week lockdown will cost 11 trillion rupiah to 25 million rupiah. This cost only needs 6% of the infrastructure budget allocation in 2021, which is 413 trillion rupiah. So implementing lockdown regulation is more effective than not implementing lockdown regulation in the economic sector. Second, We talk about unprivileged people who can't always fulfill their needs during the pandemic and then the lockdown regulation. They also can get the social assistance to help them fulfill their needs during the lockdown, such as max, vitamin, and daily necessities. The government provide assistance in the form of household electricity discount, minimum account stimulation, cash social assistance, food cards, family help programs, pre-employment cards program, and community business credit stimulation. And for example, the government provide cash assistance to village by providing 10 million rupiah with 600,000 for a family for 3 months. With this cash assistance, each family can ease the purchase of food, max, and vitamins during the lockdown regulation. And for example, Minister of Affairs Tri Risma Harini provided assistance in the form of max and vitamins for the unprivileged people by asking for help and support from Indonesia Youth. Or we can provide a solution by saving money on buying max for people who don't get the free max and don't have enough money to buy max during the pandemic or during the lockdown regulation. They can replace disposable max with cloth max that can be washed and can be used many times. It's the right solution to save expenses during the pandemic, ladies and gentlemen. Okay, next. Which side we better to create the public awareness to stop the pandemic in Indonesia? Firstly, what we offer you in this debate today? First, we offer you that by implementing the lockdown regulation, the citizen will realize that COVID really exists and how dangerous the pandemic that is currently hitting Indonesia is. With the implementation of lockdown, people will think to be more careful and maintain their lifestyle to avoid exposure to dangerous virus. And next, second, with implementing the lockdown regulation, it will help reduce or perhaps stop the spread of the virus quickly and reduce the toll from exposure to the virus compared to the implementation of PPKM. Why is this possible, ladies and gentlemen? Look at the current PPKM case compared to the implementation of a lockdown. The implementation of a lockdown is more effective when people obey the rules compared to PPKM, which still allows the virus to spread quickly because people can still go out the house and meet other people even though activities are limited compared to correct implementation of the lockdown properly closed. And third, here also provides a role and awareness for teenagers to make a real contribution to the nation even in a pandemic situation. And because of those things, we think our side will be the side that able to stop the pandemic quickly. Thank you.
Ladies and gentlemen, we have already proved to you many things towards the effectiveness of the lockdown in this debate. First, ladies and gentlemen, with the characterization of Indonesian citizen, we have already told you that it will not be effective enough if the government is only implementing the mask regulation. Second, we have already proved to you that this lockdown, though it will only go for 1 week, it will be more effective than the PPKM and will also cost less money than the PPKM, which is believed to be much better than the lockdown of COVID-19. Third, people of the surrounding will have less contact, especially physical one, which have already been proved in this debate, and which will give more awareness towards this COVID-19 being really infectious, ladies and gentlemen. Fourth, we have proved to you that if the other teams say that people will only obey the rule, will not obey the rule, there will be sanction prepared by the government. Fifth, looking at the health side, we have proved to you, ladies and gentlemen, the urgency of having the lockdown. For example, the guardians who started to search for the oxygen because of the overfilled hospital. And then lastly, ladies and gentlemen, we have proved to you that the mask regulation is not enough. Looking back at the ineffectiveness use of masks and also many places which where they are bad ventilated areas, bad ventilated air, such as for example the mall, which cannot be turned off, like the air conditioner cannot be turned off. for example, which is visited regularly by many people and cannot be avoided. That's why our team should win this debate. Thank you.